Hello, we will be discussing environment of care in the health facility, how we keep that clean. My name is Professor Folashade Ogunshola. I'm a consultant clinical microbiologist at the College of Medicine, University of Lagos. Our learning objectives today is to understand the ways to minimize the spread of infections in the health facility environment and to demonstrate the skills of healthcare waste management and disinfection in the health facility environment. Healthcare facilities and healthcare settings and environments have a high prevalence of infectious disease. And this is to be understood because there is nowhere where you have such a congregation of those who are really ill with those who are susceptible. So unsafe healthcare practices can contribute to a significant proportion of newborn infections. Newborn, other patients, staff, carers, and neighbors are at risk of infection in healthcare settings if the environmental cleaning is inadequate. Now, the role of the community health officer in the care of the environment is important. They have to carry out disease prevention duties such as cleaning, healthcare waste management, hand hygiene, and asepsis in healthcare correctly and consistently. Correct and consistent are the two operative words here. Care for and maintain the water and sanitation facilities and encourage carers of newborn to adopt appropriate behaviors. So how can you minimize the spread of infections in the health facility environment? For example, when we talk of droplet infections are infections that are spread through the respiratory route, but they are a form of contact infections in the sense that these droplets are heavy and tend to drop on horizontal surfaces. But if you're close to them, then the droplets can be directed directly into your face and cause you to onto your mucous membranes, and then you can take them in. An example of this is COVID-19. So what are the things that are important? Ventilation, because if the windows are open, as these droplets come out, they're diluted by fresh air coming in and out. So one of the things you really want to ensure is that windows are open so that you have these aerosols diluted. You also want to ensure that the space between babies is at least 1 meter. At least. If you can make it 2 meters, that would be even better. Why? Because these droplets, when they come out, tend to fall within 1 meter of the person. And as you move further away, you have less concentration. So the wider the distance, the better. Which means putting 2 babies on a bed is not a good idea at all. Then you have to make sure that you space those beds. And if you can use separate rooms, which is even better, especially for babies who are very vulnerable, or you separate babies who are highly infectious away from the other babies. And one thing that's very important for droplet infections is that you must use your mask, the surgical mask, not cloth masks in the healthcare facility, surgical masks. The other thing that's important is when you're talking of airborne infections. Tuberculosis is an example, measles is another example. And for airborne infections, separating the babies in the same space is not good at all, does not help, because these organisms are spread in the air and they stay for long periods within the air. So ventilation is again important, but more importantly, they need to be separated away from, in another room totally. And we usually prefer what we call a negative pressure room. In other words, a room in which the pressure within that room is smaller than the pressure outside, so that when you open the door, air rushes into the room and not out. And one of the things for this is that you must use a respirator. And these are the N95s, because they filter out very small particles, and these organisms are spread by very fine particles. Now, for airborne infections, they usually are not spread from contact at all. Now, the other one you need to think about are how you deal with infection of wounds and incisions. And these are infections that come from contaminated water dressings. So wound infections is one, sepsis is another, because that will be transferred by body fluids. And you should use single-use medical devices and dressings. You should disinfect the surface of the wound before you deal with it. In other words, you must have good aseptic procedures, meaning you need to wash your hands, you must make sure you're gloved, you must make sure that you use clean and sterile equipment and dressings. You need good quality water, and all your dressings and procedures must be carried out aseptically. You cannot afford because at this point wounds are the baby is susceptible, because the wound is an entry into sterile areas of the baby and can lead to sepsis. Now, blood-borne infections. These are infections that are transmitted by blood. Two major examples are the hepatitis viruses and HIV. The most important ones are hepatitis B and hepatitis C. And they're usually due to inoculation injuries, due to contaminated needles and syringes. So it's very important that when you give an injection, when you take blood, you immediately discard the needle into a sharp box, which means that the sharp box must be close to you when you're performing these duties. It is a no-no to have the sharp box far away and you have an exposed needle and you're taking it across a distance to a sharp box. That is a no-no. The second no-no is recapping your needles, because those are the times when healthcare workers have been shown to really usually prick themselves. So as soon as you've taken blood or you've given an injection, you immediately discard into a sharps box. And this sharps box must be at the point of care. You do not recap your needles. It's a no-no. You do not move around with a sharp needle looking for where to throw it in. And of course, you use single use. You do not share needles, you do not share syringes. Babies can also get infected from water and foodborne infections. Examples include hepatitis A and hepatitis E viruses, and also salmonella bacteria. The prevention measure clearly is to have safe and good quality water, which means that you must have good access to water. It is recommended that all healthcare facilities should have a source of safe water within the facility. You must have good means of excreta disposal, preferably having a flush system. And even if you do not have this, it should be far from your water source. There should be facilities for hand hygiene, and the area where food is being prepared has to be clean and has to have its own source of water. Anyone preparing food and taking care of the babies must be very scrupulous about hand hygiene, and the environment of preparation of food and where you're getting water has to be cleaned. Another problem that we have, especially in the tropics, are vectors. Mosquitoes, flies, ants, rodents, etc. But one that we often don't think about is malaria, especially where patients are in the hospital for a long time and we have no protection for them, that they do catch malaria within the hospital. So it's so important that we control disease vectors in and around the buildings. For example, because of malaria, you should have nets on the wall, in the window, or per bed. And it's often better per bed, because then you can take this out and wash it. The doors should be protected, so that swing doors that have a net to prevent mosquitoes from going in. Babies should be protected with insect-treated bed nets, and the whole environment should be, the drains should have a net so that you don't have rats coming through that as well. In terms of water, it's so important for healthcare and for infection prevention that you have adequate water for all the things that you need to do within healthcare, and that water has to be safe. You need water for drinking, for food preparation, for bathing the baby, for medical activities, for your cleaning the environment, and for the laundry. It's so important that this water does not contribute to contamination. And in addition to that, in having that water, it means you must have water collection points that are easy to reach, so that healthcare workers are not going long distances to get their water. Otherwise, there will be issues of managing, which can lead to contamination. So the water use facilities should be available within the healthcare environment. And all these are for what we normally use water for: laundry and personal hygiene and food preparation. The quality of water, it should not be contaminated. No matter what we do, you must ensure that in storing your water, it's not contaminated, it is covered, it is in a clean container. And for the distribution and handling of the water, this preferably should go through pipes. But where that is not possible and we're storing in storage containers, these must be cleaned and disinfected regularly. Disinfection for water is chlorine, which is the most widely available method. You can use liquid bleach, you can use chlorine tablets, you can use bleach powder, and other sources of chlorine can be used. And these must stay in contact with the water for at least 30 minutes before the water is used. Water for drinking should be obtained from a safe source and boiled before drinking. At the primary healthcare settings, the usual wastes include sharps and some infectious non-sharps and non-infectious waste. So e.g., non-infectious non-sharps would include gauze that's contaminated with blood. Non-infectious waste would include office material and so on. And the sharps such as needles and scalpels must always be discarded into sharps box. On alternatives such as hard plastic containers. The sharps boxes must always be at the point of care, i.e. they should be within an arm's length when you're carrying out all these activities. The infectious wastes, which are wastes that are contaminated with body fluids and can include dressings, used syringes, gloves, swabs, nappies, pads, placenta, should be stored in closed containers such as plastic bags with closures, or plastic bags placed in metal or plastic containers with lids. A larger container can then be used to store these waste bags when they are full. One important thing is that if you're storing it before final disposal, it should be in a place that is far from human traffic or animal traffic. What you do not want are scavengers going through the waste, and it should be protected from rodents and insects and so on. Non-infectious waste like paper can be recycled. Infectious waste should not be mixed with non-infectious waste. In other words, you should segregate, and this should be done at source. And where available, you use color-coded waste bags and bins for separation. I would say where available, but if you don't have it, there are many alternatives. You can buy yellow buckets, you can buy you have black buckets like in this picture. So, and you use yellow for infectious waste and black for non-infectious waste. Sometimes you may need to spray these buckets if you don't have the right color to use it. Now for cleaning, 90% of the germs we see are in visible dirt, which should be removed by routine cleaning. In hospitals, we do not want what we call dry cleaning because that causes a cloud of dust which can transfer germs to surfaces. What we want is wet mopping with hot water and detergent wherever available. You should use a separate broom and mop and buckets for cleaning toilets and bathrooms. So you should color code it. So if you're using certain mops, and those are for the toilet, it should be kept for the toilet. You should use the whole itinerary, the mop, the bucket, for sterile areas. Beds should be wiped with a disinfectant solution, e.g. 0.1% chlorine. We have what you call the high touch surfaces. These are surfaces where people touch all the time, such as railings, light switches, the knobs of doors. All these need to be cleaned very regularly. If you do not have hot water, a 0.1% chlorine solution can be used following each hospitalization. All mattresses should be covered in a waterproof protective cover, and at any time that you see that it is cut or there's a tear, it has to be replaced to protect the mattress. Otherwise, the mattresses will get infected. What you find in the hospital are what you call areas that are more likely to be contaminated and areas that are not. So those areas that are more likely to be contaminated, and you can see this in this picture, are the areas that require lots of cleaning. So, for example, the curtain that's around the patient's bed, it's always been touched by the healthcare worker, so the risk of it being contaminated is high. Any area beside the bed of the patient is an area that is often touched. So the environmental surfaces that are high touch include the tables, the chairs around the bed. But some areas are not high risk, like the ceiling, the window sill. Nobody's going there to touch them. Now, you also need to clean what we call the non-critical care patient equipment, which are the equipment that come in contact with the intact skin only, such as the bedpan. They do not come in contact with mucous membranes. So bedpan, the IV pole, the blood pressure monitors, they're non-critical and can be cleaned with 0.1% bleach, except when they're contaminated with blood, and then they have to be cleaned with stronger solutions. In preparing your chlorine solutions, which is necessary for disinfection, you must always use PPE, because chlorine is corrosive and can affect the eyes, and people who are allergic to chlorine can get like asthmatics, can actually have an asthmatic attack. And the thing is that chlorine is always evaporated, so there's always a chlorine gas around where chlorine is used. So you always wear your PPE when preparing chlorine. And what are we afraid of? The chlorine splashing into our face. So you need to have a face shield. You should wear gloves, the domestic ones, to protect your hands. You can wear a big apron before you prepare the chlorine. So the chlorine should be stored in a covered plastic container away from direct sunlight, because once you have prepared chlorine, it starts to evaporate, and over like 24 hours, its disinfecting power goes down. So you test the concentration every day using test strips, and you must make new solutions every day. You never mix chlorine solutions with any other cleaning product. Other considerations for the environment is ventilation, ventilation, ventilation. One thing you do need is lots of air to dilute any infected aerosols. You need good lighting so that you can see what you're doing. You minimize disease vectors so that you must have proper drainage around the place. You dispose of waste as soon as you don't keep food in the healthcare space. You must ensure good hygiene. Insecticide-treated bed nets is necessary in the tropics, especially in a place like ours where malaria is extremely common, and so you need to screen the windows. We should also encourage behavior, because irrespective of all the things that we've said, the way for things to occur is when the staff and the healthcare workers follow instructions, and not only follow it sometimes, but they must follow it all the time. But because they're human beings, we do know that human behavior is difficult to change, so you should have posters and other visual information to remind them. And as often as possible, have meetings where they are encouraged to consistently follow the guidelines. So in conclusion, the environment of care within healthcare facilities can contribute to the well-being of the newborn and the mother. Therefore, there's a need for healthcare workers to ensure that the environment of care is clean and will not be a source of harm to the mother and the newborn. Thank you.